Welcome everyone today to Thrive Health Virtual Open House. This is the first one that we're doing, so we're really excited about it and really happy that you've decided to join us to learn a little bit more about Thrive Health, not only a little bit about our platform and our technology, but also to learn more about what it is like to work at Thrive Health. And you'll hear from employees, you'll hear from some of our leaders. So we're super excited to have you here. We would like to acknowledge that Thrive Health is privileged to operate on the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. We also do have team members from nations listed on your screen as well. If you would like to list in the chat, if you'd like to do your own land acknowledgement, we welcome that as well. So how we'll be spending the next 55 minutes or so is we are going to hear from Alec, our CEO, do an introduction to Thrive Health. We will hear from Mark, who will do a product demo and tell us more about his clinical solutions team. We will hear from Ashley to hear about people and culture at Thrive. You'll hear from a couple of Thrivers. Diane and Whitney will tell us about their experience here. We will hear from Cody and hear more about the development team and open roles on the dev team. Sarah will then share with us how to stay connected and how to apply to Thrive. We'll have plenty of time, 10 to 15 minutes for questions and answers. So you can put them into the Q&A chat and we will answer them either as they come in or if they come in groupings, we'll try to answer them that way. And then we'll also be doing prize draws at the end as well. So without further ado, I will pass it over to I'll pass it over to Alec.
Awesome. Thanks, Davin. I'm just going to share my screen.
I've stopped sharing.
Thank you very much. Morning, everyone, or good afternoon, depending what time zone you're in. Thank you so much for joining us today. I take 5 minutes just kind of give you a bit of an overview of Thrive. First off, sort of what we do and what our mission, for lack of a better word, is, and then also talk a little bit about our values and kind of what we hold near and dear to us here. So I think everyone's aware we're a digital health tech company. We build a platform that revolves around the idea of empowering patients and providers. We talk a lot about technology that can be used to help in care relationships, and care relationships being the dynamic when someone is looking after someone else. Some of the things that are really important to us is that we understand that technology onto itself is not transformative. Technology for the sake of technology doesn't change anything. People change things. People are caregivers. And we're not out to replace those very human relationships that are so important in our healthcare system. We're not trying to substitute that with technology. What we're trying to do is to empower the people that make up our healthcare system with the tools they need to have those actionable insights to provide the best care possible. So when we talk about the problem that we solve, we talk a lot about fragmentation. We talk about the idea that healthcare is very much broken up into lots of silos that don't exchange information. And that fragmentation is really prevalent across 4 areas: fragmentation of relationships, fragmentation of workflows, experiences, and data. And when we start thinking about the impact of that fragmentation and we start looking at it from a patient perspective, it very much gets to the place that we all know is such a problem with healthcare, where patients don't understand their care. They don't understand the role that healthcare can play in making them better. We're very much stuck in a traditional model of healthcare where someone gets sick, a doctor helps them, they do what the doctor says, and they get better. And we all know that's not what healthcare actually looks like. We know that doesn't address things like chronic conditions. We know that doesn't address things like mental health. We know that there's so much more to it, and so much more that goes beyond that transactionality. And so we believe that technology has a role to play in helping reduce that fragmentation. The other thing, though, that we truly believe is that technology to date in healthcare has really not delivered on that value proposition. Although technology has an incredible ability to help bring things together, help bring data together, help bring a cohesive experience together. It actually hasn't done that. And the reason it hasn't done that is because technology in healthcare is very much driven by venture capital. It's driven by how investors want to solve a problem quickly and make a profit from it. And technology has actually made the fragmentation way worse because we've created even more silos. We've created even more fragmented experiences. Patients are drowning in portals. Providers are drowning in endless enterprise systems and EHRs. So when we start looking at all that, what we want to do is thrive and come in and say, how can we build technology that actually brings that together? And the way that we do that is by pulling together a seamless patient profile and pulling together that integration piece across enterprise systems. That's a big problem to solve. These aren't easy things. This isn't something that we can go out and do quickly. What we do is we create a Lego toolkit that we feel puts the tools in the right people's hands to create digital health solutions that can actually sit above this fragmentation. They can pull together multiple different systems. They can pull together that patient experience into a seamless experience for the patient. And by doing that, we try to put the technology to build apps, to build solutions in the hands of the people that understand how care is provided in healthcare and reduce the need for bespoke custom built apps. So unlike a lot of health companies, we're not tackling one area. We're not saying we're doing cancer or surgery or diabetes. We're actually saying we're creating a platform that can tackle all of that solutions can be built on top of. And Mark will talk a lot more about this. So we, look at that data fragmentation. We look at workflows across those different care verticals. We look at care relationships. What is the technology that's needed to pull all of that together into something cohesive? And at the end of the day, we talk a lot about empowered patients. We'll be very clear that we're B2B to C, so business to consumer. Our customer is the healthcare organization. That might be a hospital, it might be a government, it might be a healthcare system, it might be a payer. But at the end of the day, all those different organizations, all those different customers of ours have a vested interest in empowering the patients that they serve. And that's what our technology lets us do. Our technology allows those customers of ours to put something in their patients' hands that results in better outcomes for those patients. And obviously, we're talking sort of more from a pragmatic perspective here, from a mission perspective, but from a business perspective, they also have a vested economic interest in seeing those improved outcomes, in reducing that fragmentation, because at the end of the day, that fragmentation is incredibly expensive due to loss of efficiency, due to loss of patients, especially in the US healthcare system, where competition for patients is actually something that's very important, but also in Canada, where obviously we have limited taxpayer resources going to healthcare, and doing as much with those resources as possible is incredibly important. So what does that all lead to? Mark's going to go way deeper on this, but at the end of the day, we have a platform. At the end of the day, we're building software that allows others to build on top of us to bring solutions to market. We look at that in a few different ways. We have organizations where we sort of bring the where we actually sell the platform directly to our customer, and we have cases too where we have a marketplace of solutions where there's more sort of off-the-shelf functionality available that customers might take advantage of in specific subject matter domains. Logo wall here of some of the customers we work with. We work across the healthcare space, work across employers, post-secondary universities, you can see here. And so when we talk about traction, obviously we have a solid footprint here in Canada. We launched in the US in April 2022. We work on about a 12 to 18 month sales cycle with the organization. So we're seeing some of those initial conversations and partnerships in the US start to come to fruition. And really, as a company, we were founded in 2016, so we're sort of definitely solidly into our growth go-to-market phase. Obviously, always building new technology, working on V2 as a platform right now. And when we look at the composition of the company, we have sort of three groups. We have technologists who obviously build the software that we use, design it, drive product. We have clinical subject matter experts. Mark will talk about the innovation team that make sure that everything that we're doing, we never want to be prescriptive to the healthcare industry on what we as a tech company think healthcare should look like. We want to make sure we build things that reflect how care is delivered. To do that, we involve a lot of clinicians. We involve a lot of sort of the fantastic people that work in healthcare directly in the organization. And then last but not least, we have fantastic folks on the corporate side that sort of bring all that together. We want to make Thrive a great place to work, and being a great place to work is about making sure that we have a great corporate culture, and Ashley will touch on that and talk more about that. I'll close just by talking about our values. These are sort of near and dear to me. My team that's here will roll their eyes. That's okay. We talk about being bold, innovative, transparent, inclusive, and humble. Each one of these things really means something to us. Bold speaks to the fact that we are on a transformative mission for healthcare. The investors we partner with, the people that we bring into this organization understand, but this is not going to happen overnight. This is going to require big ideas that actually change sort of the fundamentals of how technology and healthcare work. And we want to have that lofty goal. Innovation ties directly into that. You'll hear a lot from Mark, who leads the charge. Transparent speaks to our culture internally. It speaks to what we as a leadership team need to be doing to make sure that, Thrive is a great place to work, that people understand where we're going, that people understand the dynamics that we're operating in. But it also speaks to our relationship with our customers and our patients. From a customer perspective, this means, being upfront about challenges we're facing, about issues we might have, about things that might impact them. And from a patient perspective, it means being clear about how we use data, what that relationship is, what our privacy policy is, what our terms of service are. Inclusive speaks to our diversity, which we celebrate. That's both diversity in terms of ED&I, but also diversity in terms of thought, in terms of leadership in the organization, in terms of the different perspectives that we bring to the table. I'm incredibly proud of the leadership team we've built, incredibly proud of the teams we have here, who bring together that diversity in every sense of the word. And last is humility. This is the one that's biggest to me. Our leaders should be the least important people in any room. And we as a company should be very humble about the role that we play in healthcare. We are just a tech company. We are putting tools in people's hands who are out there doing incredible good. It's not for us to be the ones sort of celebrating what we've done. It's about supporting others doing that work. So I will pass it over to Mark to dive deeper. I think Mark and I are wearing the same shirt, so it'll be good continuity there. And Mark will take us through the product a little bit deeper. So over to you, Mark.
Thanks, Alec. Yeah, so maybe I'll just start first by introducing myself and then give you a sense of, what's involved in the clinical team and how we sort of do the work, and then give you a bit of a overview of some of the details around the platform. So my name is Mark Nazemi. I'm a manager here, and I lead our clinical and well-being solutions. So my team is super cool, I have to say. We are made up of nurses, physicians, researchers. So we do a lot of interesting work in terms of not just building solutions for our customers, but really having meaningful conversations with them as well around how technology can facilitate their workflow in terms of optimization. It's not about just taking something and building it. It's really understanding what problem we're solving. So sometimes, we may have a clinician come to us and say, hey, I like you guys to build this form for me because I want to do this. Sure, we can just do that. But, we want to understand, well, what problem are you trying to solve? And so there may be an opportunity there where we can maybe do it differently or maybe optimize it better for them. So part of that requires you to have that innovator's hat on all the time, and just to be open to different ways of looking at a problem. So we do a really good job within the clinical team in terms of working collaboratively. So usually we have stand-ups where we meet together and discuss, what we need to do, whether it's for a project that's, let's say, due this week, or it might be a project that will need to be delivered 6 months from now. So ultimately, as a team, we've kind of figured out what needs to be done. And then there is really clean handoffs between who's doing what, but there's always a good sense of support. You're never left alone to do something, even though you're, part of the job is obviously being able to take ownership and create something, but you can always rely on your teammates to get support, or if you need to chat about something. So there's lots of that opportunity in terms of just having the freedom to do what you really love working at Thrive. So what do we exactly do within the clinical team? So maybe what I'll do is share my screen, because this will give you a good sense of kind of want to tie in both the product and the work that we do. All right, so I'll just actually skip to this slide. So there's 3 core things as part of our existing platform. So My Thrive Health, that's the care portal for the individual. So as a patient, this is where you can access everything around your health. Typically what happens is that our clinical team will be involved in building a really cool resource libraries for patients to be able to access self-management strategies that are evidence-based. We get to build all the assessments and care journeys. So a care journey, the way we define that is that everything that a patient needs to do when you're receiving care from an organization. So whether that's managing their appointments or filling out questionnaires or even talking about their experience of how their surgery went. So, in terms of providing a bit of a feedback for the clinic. So all those things, we kind of package it together and create what we call a care plan. And so that care plan then is initiated by, as you can see, it says care management, which is our Thrive Relationship Manager dashboard. This is where clinicians can then, send tasks or enable care journeys for their patients. What's really neat is that the other flip side to this is that we also do quite a bit of research work in terms of understanding, how effective we were in terms of solving those problems. So we have a team of researchers and we have a researcher in residence program as well, where we work with master level students, PhD level students across various universities in terms of, understanding how effective our approach is to solving fragmentation and bringing that whole journey back in terms of in a way that we can understand how we can support clinicians in terms of their practice, but have patients feel empowered about the care journey they're on, and also improve our own platform as we build these solutions out. So just diving in a little bit deeper. So what's really neat about the patient portal is that we have this concept around a centralized health profile. I'm sure many of you, you've gone to the doctor, you've been asked to fill out this form, and you're sitting in the office, you're like, oh my God, like this is so boring, I have to do this. Now imagine like you just do it once, and then you can share that with any of your providers. And in fact, over time, you can, manage your own health by adding, information about your medication, perhaps, how your nutrition is like, over a month. So then you can take this information and then share it with any provider. And so really, part of what we do is enabling patients to make it easier to collect that information and share it. So there's all kinds of tracking that we do. We build very cool dynamic assessments that really tailor to how you're responding. Again, there's lots of nuances. This is where the clinical team builds these dashboards and work closely with doctors and nurses at various hospitals and clinics to make sure that it's the right assessments used. And here, the Discover Center is really where patients get access to tailored, evidence-based resources. And it's what I mean by tailored is that sometimes based on how they complete assessments, they are recommended what kinds of resources they should be using, or they can search based on hashtags in terms of what they may be interested in. So again, really empowering them to get access to the right resources without being overwhelmed. So we constantly are building these resource libraries, and part of the innovation aspect of it is that we also work with interesting organizations or physicians that are developing very cool projects. So a couple of them, for example, we're building right now a cancer survivorship journey, which is meant for patients to be able to manage their treatment over a 5-year period. So this is then tailored to them. They can track their symptoms. They get the resources depending on those assessments they're completing, so they feel supported, but they can share this information with their physicians. Another cool project we're working on right now is we're working with Diabetes Canada, building a whole diabetes care journey, both type 1, type 2, and it's all based on the guidelines set by Diabetes Canada. So we get to work on these bigger level projects that can scale not just across Canada, but North America. And then in terms of research, we also do publications, we support clinical trials. So there's lots of interesting work that we do with our research team as well. And then obviously we don't work in silos. So what we work on in the clinical team really directly impacts also how product is developed. So I work with Diane and Cody in terms of understanding, based on problems we get in our clinical team, how the product team can take those and then create meaningful solutions that are deployed on the platform. So I'll pause here. That was a lot of information. I'll pass it back to Davin.
Thank you so much, Mark. That was great. Thank you. Next, we're going to hear from Ashley, who is our Director of People and Culture.
Thanks so much, Devin. Hi, everyone. Before I jump in, I just want to kind of note something that Mark had mentioned. He said he had the coolest team at Thrive. I would like to challenge you and say the People and Culture team were pretty great. We work hard, but we don't take ourselves too seriously. So something to note. So I'd like to take just a little moment to talk about our culture as a remote first company and how we stay connected. Alec mentioned we have a mission to make healthcare work better for everyone. But at the core of that mission is our employees. Essentially, we are the sum of our people. I often get asked the question, well, what is culture? Simply put, culture is our company operating system. It is how we do things and how we get things done. Alec mentioned our core values of bold, innovative, transparent, inclusive, and humble. And those core values really describe the DNA of our Thrivers. Our core values will guide us how we hire, how we promote, and at the end of the day, how we recognize behaviors. Even with remote work, we are able to foster connections within our teams and cross-functionally. So we understand that when joining a remote team, it can feel very different than walking into an office for the first day and walking around and getting an introduction to everyone. So we are very intentional about how we onboard new team members. We actually have a donut app that some of you might have heard of, where we encourage new employees to join to help you build your network and meet other Thrivers. So you're randomly paired up with someone every 2 weeks to connect, and you can get to know each other. You can talk about your favorite movie or sort of what's going on for you that week. The other piece about our culture is that we are extremely flexible. So when and how you get your work done is really up to you. We have Thrivers that work in all different time zones. So one area that we try to offer to encourage team members to be able to collaborate in real time as needed is we do have a set of core hours that we do ask you sort of work around. And then outside of that core hour kind of schedule, it's really up to you to manage your day. One last big thing about our culture is we understand we're humans, and meeting up in real life is still very important for us. So aside from encouraging teams to take time for team building on their own, we also offer company-wide events to actually meet up in real life. So we offer that in 2 ways. Quarterly, we do company on-sites for sort of the main regions where we have employees. So this past quarterly company on-site we had in Calgary, we had in Toronto, and we had a company on-site for those in Vancouver. Something that's becoming a tradition at Thrive is our December company-wide on-site. So this December, we will actually fly everyone into Vancouver. We're going to spend the week together learning, having fun, doing some work and some non-work related activities. And then we'll round out that week with a year-end party just to acknowledge all the hard work that we have done. So lastly, I just want to throw out there one thing that I'm super excited about is not only the work we do at Thrive in general, but specifically some of the work we're doing on the people and culture team to really build a foundation to support our Thrivers. And as I mentioned, I get to work with some pretty great humans every day.
Thank you so much, Ashley. I will agree that the people and culture team is pretty cool. But we're going to hear from another couple of folks who will probably say that their teams are the coolest. We're going to hear from Diane and from Whitney. So Diane, we'd love to hear your thoughts. And then if you could pass it over to Whitney when you're done, that would be great.
Thanks, Devin. Yeah, so just to introduce myself, my name is Diane Tam, so I'm the Director of Product here at Thrive Health. I've been with Thrive for over 5 years now, and my background is actually in software development. So I was a software developer for over 10 years, and I actually started off as a software developer at Thrive for a couple of years, and then I became a team lead, and then transitioned to a product management role, and then more recently into the Director of Product role. So it's a great example of how the various career paths are available to you at Thrive, and also the opportunities for growth that you can have at Thrive as well. Why my shift into product? I have a great passion for product design. I love building and designing things. So my master's degree is actually in human-computer interaction. So I love building things with the user in the center in mind, which really translates well into obviously the product role, but also very important in the healthcare space. So I've been able to pursue these passions and these interests that I have while having impact during my time at Thrive. So in my day-to-day, I just talked about what my day-to-day usually involves. My role obviously involves overseeing the various aspects of product development, and orchestrating the various activities across the different teams to ensure we're planning, designing, iterating, and implementing and testing the features that we're intending to deliver. So I work really closely with the other directors to ensure our product vision is aligned with our strategic direction as a company. I work with the other product managers and the clinical team, Mark's team, to make sure that our vision is aligned and that we're building the right thing and the requirements are clear. Work with the design team to conduct research and design and test out hypotheses around things that we believe will bring value to our users. Ensure we have touch points with client services side to make sure that we're listening to the clients, the requests, and incorporating their feedback, but also taking it one step further to not only address the requests that they're asking for, but provide further value upon what they're asking for. And then obviously working closely with the development team, so Cody's team, to ensure that the product vision is clear in terms of why we're building the things we're building and where we're heading. When I first started this role in product, it was quite a balancing act, and it still is today. And I'm talking about balancing in terms of you're balancing new opportunities, you're balancing client requests, you're balancing, actually trying to build out your brand as a company in terms of what you're actually recognized as doing, what your product actually is. So it felt like a bit of a roller coaster. And at the beginning, I was looking for a recipe. I was looking for how do I fix this? How do I do this? There must be a template out there. What's different today? I've spoken with a lot of people, a lot of other product managers that are in the space, and learned a lot. I talked to product managers at Google, and I found that there is really no template. There's no recipe. It's very different at every company. And I think what makes us really special at Thrive is that we've been able to be successful to date because we have a very intelligent and collaborative team, and we're all in it together. We're all behind the mission of the company, and we're all striving to make a change out there with what we're doing. And so I very much value that, and that's what's made it very exciting for me to work at Thrive. I'm also excited about the platform that we're building. So as Mark and Alec talked about, we're building a framework or a platform that not only addresses one solution, but various care situations, because every single situation is different. In an already fragmented space, introducing another point solution will only contribute to the fragmented problem. So we're not trying to just do what's been done out there. We're trying to take this from a very different, innovative perspective and introduce a different way to approach the problems that many people have tried to address. So I'll leave it at that, but happy to answer any questions if you have any. Pass it over to Whitney.
Thanks, Diane. My name is Whitney. I am a software developer here at Thrive. I started about 4 months ago. I wanted to work at Thrive because I think everyone in BC has experienced the gaps that exist in our healthcare system and felt that frustration and feeling like they're slipping through the cracks. And Thrive is actively trying to change that and empower patients to be advocates for their own healthcare. As a human being, I think we all want to make a positive impact on the world around us. And while working at Thrive, I feel like I'm actively working towards bringing about positive change. While also being a developer and interviewing at Thrive, I also noticed that a lot of our developers had been here for 4+ years. And it was great to see a company that had so many developers who had stayed with the company so long. And it just kind of told me that obviously they're doing something right. As a developer, I'm currently working on the Circle project. We work in React, developing healthcare solutions to provide patients and practitioners a more holistic view of their healthcare. Specifically, I work with the Own the Podium team. I'm not sure where our name actually came from. It was created before I joined. Diane might be able to answer that. But they're a group of talented developers who are all very passionate about development and eager to find solutions. We are a mixture of developers that are new to Thrive and senior developers who have been here for quite a long time. And like any job, you can get frustrated when working on something, but the big difference at Thrive is your team is there to lift you back up and help you if you need it. We do a fair bit of mob or pair programming if an issue merits a discussion or provides the opportunity to share some institutional knowledge. We also do code reviews to make sure things are documented and done correctly. they've been a big source of growth for me personally as a developer to improve my coding habits and learn from others' implementations. And while we are a remote team, we actively try to stay connected and use our Slack channels to keep up to date. And we've chosen to do for our team specifically, a circle roundtable, which for us is an hour once a week where whoever's free can get together and like play an online game like Codenames or Pictionary. It's been a good icebreaker since we have quite a few new employees on our team, and it's given us an opportunity to get to know each other a little better. We generally follow like an agile software development lifestyle and have stand-ups in the morning and discuss what our plans are and what we want to accomplish. But that's just kind of what we've been doing in like my day-to-day life as a developer, I suppose. And other than that, I'm relatively excited for our Circle launch, which is coming up quickly. We've built in such a short time that I've been here at Thrive, and just how quickly the company is growing and expanding and reinventing how it does things to improve our work life cycles. And last but not least, I was asked to provide a piece of advice to anyone applying to Thrive. And my advice would be, people thrive in an open and honest environment. So just be yourself and good things will come. Anyways, thank you. And back to Davin.
Thank you so much, Whitney. I would agree. We really want people to be their authentic selves when they're applying. So that's a really great piece of advice. And on the podium, I don't know where that name came from. If there's a panelist that knows, if you want to jump in now. We are going to hear from Cody next, who is our VP of Engineering. Maybe he knows. Cody?
I don't know the exact origins of the names, but I could throw in a couple guesses. But I'll save the crowd as a whole from that. Thank you, Davin, though, for the introduction. Appreciate it. So as Davin said, my name is Cody Thompson. I'm the VP of Engineering here at Thrive. I'm responsible for the teams that contribute to the technology at Thrive, including our software development teams, our operations team, and our quality assurance team, which for the record are all of the coolest teams here at Thrive. In short, I am privileged to work with a lot of incredibly talented people. I was asked to help to sell the development experience at Thrive, but quite frankly, I think Whitney did a better job of that than I could ever, but I'm going to give it a try anyway. So software development with Thrive is a truly exciting opportunity for those interested in full stack development. Thrive's health technology is built with a fundamental understanding that awesome user experiences supported by best-in-class technology will enable our success. We are ingrained with the values of Scrum and Agile that Whitney mentioned and use those to guide our software development teams. Reporting structures amongst our development teams are flat. Every developer is encouraged to contribute their knowledge and ideas to help shape our product and technology across the company. With our focus on creating amazing user experiences, we have a highly talented UI design team that works directly with our software development teams to create great user experiences. We build on top of really well-tested and industry standard front-end technologies, such as React and TypeScript, to ensure an excellent development experience for developers building the front end of our application. Backing up those applications, we're powered by the AWS cloud, which enables us to deliver great technology quickly, continuously, and allow us to scale to the needs of our customers. Our backends are powered by the technology of our choice. Typically, Node.js, TypeScript fill out a lot of the services that power our front ends today. Ensuring that our applications stay running, we've embraced DevSecOps, allowing us to adopt continuous integration and continuous delivery in all of our software offering. We believe in giving our developers the right tools they need for success. We leverage the power of technology partners in Auth0, GitHub, Datadog, and numerous others to ensure that we have the right tools to support our teams in every way to enable them to focus and deliver the best software and health technology. We believe in having our developers participate across every aspect of our technology. We are truly committed to being a full stack shop. Our developers participate in all aspects of the software and its delivery to our customers. Look, we're currently hiring for full stack developers. It's a really exciting opportunity here at the company to help shape the future vision of our software. We're looking for you to help contribute to the future of our technology at Thrive and drive on us realizing a truly amazing platform to empower patients to be at the center of their healthcare journey. Now, that's all I have. I hope that Whitney was able to do a great job, and I really just wanted to take one moment to shout out Davin, Sarah, and Ashley for putting together this amazing open house, and I'll pass it back to Davin for closing.
You're muted, Davin. Davin, you're muted.
Thought I was going to be able to get away with the whole meeting where I didn't do that, but here we are. Thank you so much. We are going to, before we get into the Q&A portion, we're going to have to hear from Sarah, who is sort of my partner in crime on the talent acquisition team, who's going to tell us more on how to apply, how to stay connected. things of that nature.
Hi, everybody. Thank you for joining us today. My name is Sarah. I'm working with Davin and Ashley in the People and Culture team, particularly talent acquisition. And so there are different ways that you can apply and network with us. This event is one of them, and that we appreciate that you participated. I'm going to copy paste our names, Davin and I names. You can add us on LinkedIn, and you can reach out to us, like DM us if you have any question. And then we have a career page that you can always check. And then we have all the job postings there. If you are, if there is no job post there, still we encourage you to connect with us on LinkedIn and then have a chat with us if you are in health industry, or if you are interested in pursuing a career in health industry. The other way to stay connected with us is our LinkedIn page, Tribe Health LinkedIn page. I encourage you to follow us on that page. Other than the job posting, we have a lot of other awesome things there. For example, like we have monthly webinars that they are on healthcare, like concepts that everyone can learn. And yeah, that's pretty much about it. So I hand it over to Davin to go for the Q&A.
Thank you.
Thank you.
So if you have any questions, if you do want to put them into the Q&A section of the webinar, or if you want to ask it more like live, if you want to raise your hand, we can unmute you, and we can take questions that way as well. So one of the questions that has been asked are, what are some of the entry-level positions that you are looking for in Thrive? I see a lot of senior roles. And you're right. Right now at the moment, all of our roles, I would say, that are listed currently on our website, particularly on the development team, are senior. We do have a couple of like the data analyst role. That would be more of an intermediate. Contract and compliance reporting manager, I would say that would be more of an intermediate level role. So at the moment, we don't have any entry level roles. Our strategy is more to fill the required intermediate and senior roles first. And then once those people are sort of settled in and going, we will have more likely have more entry level roles, more likely next year. Does anyone on the panelists, do they have anything that they would want to add onto that? Let's see if there are any more questions. Oh, Zoe's asking, what type of project management positions exist at Thrive? Would this be kind of a Diane or a Cody Alec question? Anyone want to chime on? I know we haven't typically had them, as far as I know.
I can start. So I mean, there's a few different areas I'd say where sort of project management is involved. We used to have actual project manager roles. We've sort of moved away from that. So on the commercial side of the organization, so we have all of our implementation services. So, you know, how we actually deliver technology to the customer lives on our commercial team. So there's a couple things on that side. John Lansink leads our enterprise services team, which has implementation specialists who play quite a bit of a project management role. They're more technical. We have our customer success managers, Kash's team, who also have project management, sort of an overall account management in their function. And then on the technical side of the organization, you know, project management definitely lives on Diane's product team. As you know, we have Scrum Master roles such as Dylan, who sort of coordinate delivery of technology. So, you know, we don't have a ton of sort of PMP project manager roles other than sort of the ones that lead client implementation, but that's sort of the landscape across the company. I don't know, Diane, Cody, if you want to add or correct on that.
Oh, that's great. Yeah, like I think you're kind of assuming a lot of the project management skills and responsibilities as part of these other roles in your day-to-day.
Thank you. We have another question from Cindy. Can you talk a little more about the onboarding process for your customers? Specifically, if they are bespoke implementation, if they are bespoke, how do you scale?
Maybe I'll take that because we don't have any commercial folks on the call. Maybe I'll hand it to Mark to talk more about the clinical implementation side. So it's a really great question. We aim to come into any customer engagement with, let's call it 80% of kind of what's needed pre-built and off the shelf. We recognize that we are hybrid. And what I mean by hybrid is that I think in enterprise technology space, having professional services is sort of a necessity. It's very, very rare that, at enterprise scale, which healthcare is, that you can just sort of take off the shelf SaaS solution and kind of deploy it, especially when we're talking about, core aspects of an enterprise technology stack, not, a small SaaS solution that's getting kind of tacked on. So the long and short answer to that question is great people. While we're implementing technology, it is a very human nature to work on these projects. And so, both John Siemens, Cash's team have playbooks that we've developed that, help lead that digital transformation for a customer. It's more than just, the nuts and bolts of deploying the technology itself. It's about understanding kind of what the customer is setting out to do, what that holistic picture looks like, and how we drive towards it. And that's why we have folks who have deep understanding of healthcare, who have deep understanding of the technology. How we scale that is that we scale it. We resource plan for what's coming. We understand what's coming down the pipeline. We understand what our sales team is out doing, and we make sure that we have the resources needed. We also partner as well. So, for example, on larger RFPs, we'll work with implementation partners like Deloitte, like KPMG, those kind of things. So yeah, it's heavily considered. It's a great question though. Maybe Mark, do you want to add anything from the clinical implementation side specifically?
Yeah, absolutely. Yeah, it is a great question. And so part of it is that we look towards standardization of care as well. So for example, like with diabetes, for example, the reason we follow and work with Diabetes Canada is so that we can use their guidelines so that all diabetes services across Canada use the same assessment. So that is one way that it supports scaling. And in fact, technology makes that easier because once we build it, it's available to all to use. The other is that, again, think of it as a journey, right? If we want to, customize every little thing, well, that's time consuming. But if we offer it as a package solution, so for example, if you're going through surgery, if you're able to do your intake, manage your appointments, and then post-recovery, that's a standardized care around surgical optimization. So again, we build that as a model at first, and then build it as a care plan collaboratively with the clinicians. And then again, that product can scale across various hospitals in North America. And then we can make little, tweaks here and there if needed. But ultimately, that's the goal. And that's the nice thing about technology, where we can really provide that evidence-based standardized approach. And then we can provide the analytics to kind of show the impact that it's making. Because if everyone's doing something different, how would we know it's working well, right? And so this is why people come to us, because we are able to show that approach of building these standardized journeys.
Thank you guys for the great answers. The next question is from Hossein. Are there internships positions also expected for next year? So right now we are actually going through the process of hiring some co-ops for our development team, and we're in partnership with two schools, maybe three schools. I believe it's SFU, UBC. Is it just those two, Sarah?
Yeah, we are in the process of Concordia University too, but we are not there. It's more like graduates.
Yeah, and I know sometimes like co-op and internship, like sometimes they're synonymous and sometimes they're not. So I think Hossein, Sarah, do you mind connecting with Hossein and just trying to make sure that we, in case he means co-op or internship, we can talk to him directly with that. We do have a question. I believe this will be for Cody.
I think we know Hossein. How are you, Hossein? We talked to Hossein.
Oh,
yeah.
There you go. Look at that. The next question is, I see that you use a lot of JavaScript frameworks for your backend and front end. Do you use any other languages like Python, Ruby, Java? Cody, do you want to jump in?
So the vast majority of our backend is entirely in JavaScript. So that's an absolutely accurate statement. We're not opposed to other technologies, but we don't see a lot of fit for Ruby and Java. A lot of our developers are using the tools that they're most familiar with and are best be productive with. But we definitely are open if the right solution with the right technologies in place in the backend to support another language. We would absolutely support that. I'm honestly have a lot of professional experience with Python from my past as a software developer as well, and big fan of it. But yeah, it definitely at Thrive we're mainly a JavaScript TypeScript shop.
Thank you. We've got another question from Cindy. How does your product integrate with the hospital's clinic systems? What current healthcare standards such as FHIR, HL7, etc., are you using on your product?
I can answer that one. So yeah, integration obviously is huge to what we do. It looks different everywhere. I will say, like, Diane and I spent a lot of time talking about how we make this consistent and how we build something sort of unified for it. The reality is just that every large scale deployment of EHRs and EMRs are so different in hospitals. Like, two hospitals can be running Cerner, and depending what modules they purchase and how they configure them and what their network topology looks like, it can be completely different. So that's why we have John and John's team, who sort of really work to understand those integrations. What I will say though, from a standards perspective, so our entire platform is built on FHIR. So we actually use FHIR as kind of our internal data model so that we don't have to do a ton of translation back and forth. As much as possible, that's our default in terms of HL7 data exchange. It's the healthcare system. We also do a lot of SFTP and CSV file dumps and EFACs, heaven forbid, because that's just the reality of what it looks like. So really, it's a matter of sort of meeting customers where they're at in terms of what that looks like. The other just shout out that I'll give is we are working with a fantastic company in California called EmTruth. If you haven't heard of them, it stands for Empower Truth. A bunch of people far smarter than us who left NASA JPL to found that company, and they make a product that uses blockchain to actually tokenize and credentialize the data that's coming out of one system into another, and so you can actually like understand that this patient observation came from this specific device and this specific date, or was patient entered, and build that sort of data pipeline. And we are partnering with them for a lot of the integrations that we're doing, like at Ottawa Hospital and such. So anyways, that's a broad answer, but it reflects the messiness that is interoperability in healthcare.
Thank you. We've got another question from Kelly. Would love to know more about your research program. Are researchers solely recruited from academic institutions and graduate programs, or are researchers able to apply for these roles as well?
Mark?
This is going to be a Mark question. Is Mark still here?
Sorry, I was responding to a critical message. Sorry, what was the question around research?
Yeah, and how do we recruit? Is it only from institutions, grad programs, or we often open it up to like an apply to this job on our website type of thing?
Yeah, I mean, it's a great question. I mean, so far we've had researchers that have been from universities. So UBC we've had a few from UBC. Right now we also have a researcher from Penn State. So it's open to, various, master level or PhD students. Having said that, if there's someone from industry that's looking to also get into research and they've had some research background, especially around machine learning and developing algorithms, we're certainly open to that. So it ultimately comes down to what are your goals with research, and have you done that work in the past? And then if you're part of an organization like UBC, for example, there's the Flex program that you can through that be able to obtain an internship. Of course, there's co-op, there's MyTax. So there's many different avenues that you can get involved with us conducting research.
Thank you, Mark. So we've got a few minutes left. There are two other questions that came in from Tace and Kelly. I'm gonna follow up with you directly on that. And then on the topic of like, how do people apply? I know one of the questions that came in internally was, can people apply generally? And not quite yet. We are about to, what we will do is put like a general application job on our website. We will be moving to a new applicant tracking system. We have a new toy in talent acquisition I'm super happy to play with, and that will have a general application link. So that's going to be in the next 6 weeks or so. But I do want to pass it over to Sarah, who's going to draw for a couple of prizes.
Okay, the fun part. So before we proceed, I took a list of attendees, but I was not able to recognize G subs. I don't know your name. So I left you a message. If you don't mind, I can allow you to talk, to share your name with me. Let me allow him to talk. G-Sub, would you mind if you share your name?
Yeah, my name is Gix. I just sent you a message already. I'm not sure if you saw that, and I added you on LinkedIn as well because I couldn't find a way to change it really. Yeah.
Okay, thank you. So your name is
Gix.
Gix.
Okay.
Then the questions.
Thank you so much. So let's do the draw.
What are we drawing for?
Oh, you're right. Okay, so we are drawing for something very interesting. I just got familiar with this platform, like Davin found it. So there is a Vancouver-based company. Their name is Gusto, and then they work with different companies. If you are a fan of retail, if you love HomeSense or Marshall, or if you want to go to Gap, for the gas pricing is too high, so Esso is there, Amazon is there, they have different options, and we have 2 gift cards with Gusto that you can choose what you want to go for, and then there are $100 gift card, and we are drawing for 2 winners today. Okay, so let's do the draw.
Sarah got the fun part of this.
Bear with me. Okay, let's generate the first one. Number 23 on the list. Let's go to the list. Number 23 is McQueen Pinto. Okay, congratulations, McQueen. We will send you an email this afternoon with your gift card and instruction how to use it. And thank you so much for participating in this event today and your interest. Okay, let's go to the second person. Number 15 on the list. Okay, that's Jason Kai. Congratulations, Jason, and thanks again for your participation and interest. We will send you an email this afternoon with the details.
And just thank you so much. We're getting close to the top of the hour, so we'll be wrapping this up. But I just want to thank you for attending. I want to thank the panelists for participating as well. And I think it was a really good first time out the gate. So I'm really happy. We have recorded this, so we will be putting a copy of this on our careers page, YouTube channel, things like that. So thank you so much to everyone. I hope you have a wonderful day and rest of your week.